Hi everyone, welcome back to Unlocking Minds on Autism with Ronki Moore. If you're new here, thank you for being here, and I hope you find all the videos in this channel helpful. Today, I'll be talking to you on the disadvantages of an in-home ABA therapy based on my personal and work experience. So let's get started. As we all know, ABA is a widely used and evidence-based intervention for people living with autism. While it can be highly beneficial for many people, there are some potential disadvantages of ABA therapy in the home. And I'll be sharing with you a couple of these disadvantages. These disadvantages can vary depending on specific circumstances or your child's needs. The first disadvantage of in-home ABA therapy is limited peer interaction. In-home ABA may not provide ample opportunity for your child to interact with other peers at home because it's not a classroom setting, it's in the home. And these may potentially impact, the development of social skills in group setting. When you're having in-home therapy, it's only for that child who is living with autism. There are no other peers around. And I'm not talking about siblings here. I'm talking about other children which your child can interact with, can have social skills with. So with an in-home ABA therapy, there is limited peer interaction. The number two disadvantage that I'll be talking to you is lack of consistent behavior therapists. And I don't really know if it's only our family that is facing this dilemma, but I noticed that there are lack of consistent behavior technicians in in-home therapy. Since COVID, we had limited in-home ABA therapy. Most times we did it online. But now that everything has returned back to normal, we try to start the kids back on, ABA therapy. And we started back last year. So Daniel has been in and out of ABA therapy because he also has access to ISS. And I will talk on that, in the future. So with Dara, we started ABA therapy back last year. And, the first therapist that came into our home, she was really cool, really nice, until I found out that, she was pregnant. And that did not stop her from working. But the only thing is, she had some moments sometimes when she had to go for a doctor's checkup. And, she has kids as well. So it was really difficult to be consistent with, coming to our home to provide therapy for Dara. That was really hard. And at one point, she had to give up because she was having cramps or something like that. And she was out for about 3 or 4 days. So, the owner of the agency called me up and said, I'll be bringing in a new therapist to come work with Dara. And we were like, that's totally fine because we understand, the situation of the first therapist. And after a few weeks, we had a new one. She is an amazing woman. Dara got to bond with her pretty good. It takes some time, especially if you've worked in the field of ABA, to pair with some of our children. Sometimes you can pair really fast. Sometimes it might take a little bit of time. So with this second therapist, Dara was able to pair very quickly and very fast. It was awesome. Dara loves her. Along the line, she had a death in her family. And it was really, really bad that she had to be off also for a week. And, I'm already thinking in my mind, like, I don't really want her to go, but at one point she had to talk to me that she has to cater for the kids that our cousin left behind. So she was unable to continue with us. That broke my heart. Even after she left, Dara kept calling her name every time. The third therapist, she came in and, she was here for a day. And then the following week, she didn't show up. And I totally get it. As someone who has worked in this field before, I know it's kind of hard to have, the hours because kids will go to school in the morning. They are back around 4 and then they start therapy. So it's limited hours. So if you're working as a BT, it's a part-time because there's no consistency with the hours. Families can cancel and the BT can cancel. So it's really hard to run those programs that are specifically meant for your child. So I don't know if I'm the only one or it's only my family that is going through inconsistent, behavior technician. But, if you're not able to do the job, I think it's better to just come up with a family and say, no, I cannot continue with that. But it's been a challenge that we've been facing, pretty lately. So over time, we've changed about 3 or 4 therapists for Dara in a matter of a few months. I've worked in the home also as a BT, and I try to, cheer up and also get to meet the BT, bond, talk to them. We have those moments where, we do a lot of talking, to get to know them. And I also share with them that I've worked in the field before so that they're comfortable, to know that this mama do understand what might be going on or what might be the challenges in this field. So if you're having the same, please feel free to share in the comment section. If you've changed therapies, over time, just let me know that I'm not alone, in this. But with Daniel, we've not changed his therapist so far. The person that has been working with Daniel is still working with Daniel. The third disadvantage is parental stress and involvement. In-home ABA can place a little bit of stress on parents because they have to also participate and learn the strategies that will also work for their child. So it's kind of stressful, especially for the working parents, when you come home and you have your ABA therapist and you have to be part of the therapy, to see what they're doing with your child, to see how to run the program, to see how to continue with the programs. So it's a lot of stress for parents, for families whose child are having in-home ABA therapy. I also remember that even in early intervention, I have to make parents participate because they are the ones who spend more time with their child. So it's very important that, you want parents to see what you're doing so that they're able to carry over when you leave their home. The fourth disadvantage that I'll be talking to you about is continuous in-home ABA therapy can pose potential intrusiveness into the family's daily life, impacting the family's privacy and comfort. This is something that is really hard. When I used to work as a BT, when you walk into a home, you are intruding into the family space. So I try as much as possible to make myself comfortable and also make the family comfortable as well. And I've also learned to accept people the way they are. So you want to be careful about how you intrude into other families' privacy. And that is one of the disadvantages, because when you're in your home, people are coming into your home. They see what you're doing. They see what you're cooking. They see what you have in your home. They see a lot of stuff. So there's no form of privacy when you have an in-home ABA therapy. If you're enjoying and getting a lot of nuggets from what I'm sharing, please click the subscribe button. Thank you for subscribing. So let's move on to the next disadvantage, which is limited exposure to diverse therapists. When I used to work in an ABA center, we switch our children. We switch in between kids. You work for one kid for about 3 hours, you move on to the next kid. But with in-home therapy, you are stuck with one person. Imagine what I shared earlier. You have only one therapist that you will work with almost every day, depending on your child's needs. But, in a center, you have diverse therapists with different teaching skills, different teaching styles. In the center, it is more intense because when someone calls out, you can definitely get another person to cover. So you have different people with different styles, and that will help the child to also understand that I do not have only one person that works with me. I have different people working with me. The next disadvantage that I'll be sharing with you is resource intensity. ABA requires a lot of resources, time, space, and I would say toys. things to work with your child. If you have a limited space or you don't have a big space for your child, that may be a disadvantage. And if you do not have enough toys or resources for your child, that may also be another disadvantage. You know, I remember when I used to work with one family, what I do is I will go to the store, buy the toys and keep it in my bag, bring it into the home so that this child is not satiated. Every time when I come in with this bag of toys, this child is excited to have me, is excited to see the toys, is excited to play with me. You know, I can always get his attention. I hope this was helpful to you. Please like, share, subscribe, and comment. Let me know what you think about, these disadvantages that I've highlighted in this video. And please feel free to share what your experience has been with in-home ABA therapy. Until I see you in my next video, thank you for watching. Bye.